Today is International Overdose Awareness Day, and the theme this year is recognizing those people who go unseen. So we know many people that are using substances live with the stigma and the shame. They're using at home, or they're afraid to get the help they need because they're worried about the barriers to employment, child custody, the stigma that comes from their family and friends. So today is about awareness to end the stigma for people that are using substances. It is a health issue, and we need to push government to deliver an aggressive health-based response to the toxic drug crisis that's claiming many lives in our community and across Canada. I saw that Portugal had 6 overdose deaths per million last year. Here in British Columbia, we're at 430, and Vancouver Island over 500. But in the Alberni Valley, we're topping over 1,000 people per million. And under the age of 44, it's 2,100. So we're off the charts. And this is impacting everybody in our community, toxic drug overdose. So going to Portugal, learning how they tackled their toxic drug crisis back in the late 90s, early 2000s. And what I learned was they took an integrated, compassionate, coordinated approach that saved many lives. And they went from 1,000 people dying a year in a country of 10 million, which is far less than what we're seeing here in British Columbia, to what we're seeing today is a total of 60 people in Portugal last year. So they've done remarkably well. They responded and treated their crisis as a health emergency. And some of the things they did is they created 45 local organization hubs, if you want to call it, to deliver a health-based response, harm reduction, and treatment and recovery, so they could meet people where they're at. They built treatment centers right across the country so that they could get access, people could access treatment on demand when they needed it in a timely manner, because we know the window's so small when people need help. And they focused on recovery because we know people relapse that use substances. So they spent a lot of money on recovery, prevention, and education. And they also established what they call a dissuasion commission. I'd call it more of a persuasion commission, where they sit down with local experts on social policy, on judicial, and also health experts that check in basically with the user, make sure they're getting the supports and are aware of what supports exist to help them live the best life possible. And that is their focus, is to make sure that people that use substances get treated in a health-based manner, and that they get the best supports they need for success in their lives. One of the biggest successes of their approach was they got the politics out of the issue. So right now we see this ideology war happening right now in Canada, where you've got one party that believes in only treatment and recovery, another one that supports a health-based model, but they're taking an incremental approach. There in Portugal, the heroes in terms of the political spectrum were the politicians took their gloves off. They stepped back from their ideology, and they got behind the experts to deliver and guide them through an evidence-based policy, and they supported that implementation with the resources that were necessary. They developed a plan, which we don't have in Canada, and a timeline, which we don't have in Canada, and they implemented it. So I was really impressed with the fact that they did that. Even when they changed governments through elections, they stuck to supporting their experts and resourced it adequately. There is hope. If we take a health-based approach, if we can get the politics out of it, and support the experts to deliver treatment on demand, recovery, prevention, education, and drug replacement therapy through a safer supply of substances. They need to move rapidly, like Portugal, develop a plan and implement it. And that's what we need to have happen here in Canada. We've had more overdose deaths in Canada than the whole European Union. And there's 450 million people there. It crosses NDP, Conservative, Liberal lines in Canada. This isn't a partisan issue. This is a human issue, and it's a health-based issue and societal issue. And we need to get behind the experts, and we need to get the politics out of it. I'll continue to put pressure on government every day until we implement an approach that's going to save lives.